Welcome to Let's Talk About Health, powered by Focus on Diabetes. Focus on Diabetes partners with accredited doctors to share education and new treatment options, world class healthcare organizations to introduce new technologies and free screenings for diabetic patients, their family, and the community. Now, let's talk about health.
Hi, everyone. My name is Tiffy Greer. I'd like to thank you guys for joining today. Let's talk about health. I have with me today is Dr. Siatta Dunbar. So everybody join in and let's talk about health.
Love it. Thank you for having me. Sorry to cut you off. I just want to
Oh no,
say thank
you're
you.
fine. You're fine. We're happy to have you.
Thank you.
I'm just going to do a little bio on Dr. Dunbar. She is double boarded in family medicine and lifestyle medicine with fellowship training in sports medicine. She entered medicine as a second career after spending 10 years as a project manager in commercial and retail construction. That's a big difference.
Yes, it
Um,
is.
Her commitment to developing meaningful relationships that are focused on creating health and increasing quality of life led her to start Ceravit,
Ceravit, yeah.
Ceravit Wellness. It is built on the premise that healthcare should be collaborative, not is it
Prescriptive.
prescriptive. I'm
Yep.
thinking about prescriptions.
Which is, yeah, basically, yeah.
Okay.
Yeah.
Inclusive and accessible to those marginalized by our current healthcare system, and centering your life around the pillars of lifestyle medicine is foundational to achieving and maintaining health and vitality. So, welcome, Dr. Dunbar.
Thank you very much, Tiffy. I'm happy to be
Um,
here.
I just did your bio, but can you tell me a little bit more about yourself? The big change
Yeah.
from project manager
Yeah.
to
Medicine.
doctorizing.
I know, right? Exactly. Exactly. So I guess the nice way of saying it is I'm a non-traditional student, or I was a non-traditional student. So I did my undergraduate degree in architecture. And then I went into construction management and did that for close to 10 years, and had really two pivotal things in my life that started to push me towards medicine. And then the second is really when I said, I'm being led in a direction and I needed to honor that. So my sister died of metastatic breast cancer very young in
I'm
her 30s.
sorry.
Thank you. And that was a shock. And that was the beginning of me started saying, gosh, let me dip my toes in healthcare. So I started volunteering as an EMT. I went and took the classes, and I was riding the rescue squad at night, which my mother hated. She was very prim and proper and did not want her daughter sleeping in a firehouse and jumping on an ambulance at night. But nonetheless, I did that. And then fast forward many years later, unfortunately, my mom passed away from a heart attack. And that was really kind of the push. And at that point, shortly thereafter, a year or so, I quit my job. I left my job in construction. I actually moved in with my brother and really started to think about how do I get into health and how do I give back, right? Try to save somebody else the heartache that I've had losing my mother and my sister, try to contribute in some way. And I ended up going back to school because I didn't do any sciences in my undergrad since I did architecture. So I had to go back to school for almost 2 years while I was working, and got my post back, and fast forward, went into medicine, and I loved it. I mean, I loved sort of developing relationships. I found through my training that I loved being a family physician because it really was about developing relationships and really getting to know people. So I love that part of it. But I learned really quickly that healthcare is not always focused on health, that it's really about disease management. So then I stumbled on lifestyle medicine, which was like, those are my people. And I really feel so blessed to be doing lifestyle medicine because that really honors the reason I went, and it honors my mom and it honors my sister, because this is how I feel like, and I've been able to really give people their quality of life back as opposed to just writing, prescriptions every 30 days. So I could talk for days and days on end about lifestyle medicine. So that's kind of my windy road to medicine. And
Okay.
I couldn't have done it any other way. It's taken me a while, but I feel blessed to be where I am, and I love what I do.
Well, that's good. We're glad to have a provider
Yeah.
like you because it's definitely a different
Yeah.
world with healthcare now. So,
Yes.
can you kind of tell me a little bit more about lifestyle medicine, though?
For sure. Yeah. So lifestyle medicine is really it's evidence-based, using evidence-based interventions around lifestyle. And there's 6 pillars. So it's your nutrition. What are we consuming? Because that's what we do most of the time, right? Eat 3, 4, 5 times a day. So what are we fueling our body with? So it's looking at the research to say what nutritional pattern is going to prevent and in some cases reverse disease. So what should that nutritional pattern look like? Then it's, are we moving? How much? If we can, and if we can't, how do we support people to do that? Are we managing our stress? We can never get rid of it, but are we doing a good job managing it? Because the evidence shows that stress can actually create changes in our called epigenetic changes that can sort of predispose us to disease. So, are we managing our stress appropriately? Are we sleeping enough? Are we avoiding risky substances? And then do we have good social connection? I think during COVID, we lost each other, right? We all kind of went to our separate corners and we lost the ability to really see the whites of people's eyes and have meaningful connection. And that, at least working in urgent care at that point, it was awful to see how people were struggling with that lack of human connection. So that's actually one of the pillars of lifestyle medicine is maintaining those deep, commitments to connectedness to other human beings. So those 6 pillars are what lifestyle medicine is. So how do we leverage the research around those pillars to prevent disease and even reverse disease? And it's a team-based approach. So it's the doc, it's health coaches, it's nutritionists, a pharmacist in order to start to de-prescribe medication because we find that we can tend to do that. So it's a team-based approach to healthcare, and it's about health, right? Restoring health and quality of life, not just I'll see you in 3 months and we'll just re-up that prescription for you.
Okay, understand. So how do you kind of bring all that together with your, I'm going to say with your team, the team that you work with?
Yeah. So, and this has been an evolution. So right before COVID started was when I really learned about lifestyle medicine. So I started to go through my board exam, started to learn about it. And again, it was like, oh my gosh, this is the holy grail. So immediately I started to just have conversations with patients. And if they were interested, I would really talk to them outside of clinic because the clinic setting does not afford the time to have these sort of meaningful conversations. So that's where I started, just really chatting with people outside of clinic. That has now evolved to providing sort of that team-based approach on sort of a virtual format, right? So I do group coaching, where we bring together 12, 15, 20 people, all with a common goal. And we meet once a week. I provide some educational content. The coaches are there to sort of support them longitudinally through that. And it's all, virtual on a social platform. But that's taken, a couple of years to kind of get me there. I kind of found my way slowly, and I keep iterating, right? As people give me feedback, things that are working, we keep with it. Things that are not, we continue to evolve. Because the goal is to support people. Change is hard. Changing our lifestyle can be challenging, but man, if you put people together that are all moving in the same direction and you support them, it's a beautiful thing to watch. It's really very exciting. Yeah.
Man, it's kind of hard though. I mean, I like it for me because I keep saying I'm going to try to make these lifestyle changes, but not necessarily make that time to do that. So I'm like trying to find a balance in between to figure it out.
Sure. Yeah. And it really depends on, I tell people all the time, right, that just from a nutrition standpoint, nutrition is on kind of a continuum, right? We know kind of all the way to the right is, the optimal eating pattern that's going to have the lowest risk for disease. You're going to be able to reverse disease, the ones that we know are reversible, lower your risk of cancers, essentially, eliminate your risk of getting type 2 diabetes and heart disease. So we know that nutritional pattern, but that doesn't work for everybody. And then there's a continuum all the way from here, all the way over here, which, standard American diet, highly processed, fried food, the sugar sweetened beverages, the whole deal. And there's lots of room in between. And it just depends on, what are your ultimate health goals? Are you trying to reverse disease? Are you trying to manage risk? And where does it work for you and your family? And then you find
Right.
your sweet spot, right? You figure out, okay, what am I willing to do consistently? And you do that, because every step towards this optimal eating pattern confers benefit, right? It's not like you got to do 100% in order to get benefit. Every little bit helps. And I found, even in my life, because I was eating the standard American diet, that's how I lived, right? I was not eating well. I wasn't sleeping well. I woke up exhausted, went to sleep exhausted, burning the candle at both ends. And as I changed my nutrition and then slowly worked in exercise, really worked hard on my sleep because I was staying up late, waking up early. When I really dialed all that in, every little bit was like, I got a little bit more, got a little bit more. So I started where I could, and then I just continued to stack those choices once I got comfortable, because at some point, the change that you make becomes comfortable. It doesn't feel like work anymore, right? You're not
Right.
using your brain quite as much. And you're like, oh,
Me.
okay, this is easy now. All right, now let me tackle the next thing. But if you try to go all the way to the end, whew, that's hard.
That's me.
Yeah.
That's me. That's definitely me. So tell us a little bit about Cervite.
Yeah,
Well,
CeraVe. So that's kind of that entity I started right before COVID. Again, just really casual, after hours, on the weekend, just being available, just giving people the power, letting them know that their health is truly within their control, which I don't think we do a great job of in healthcare. Just the way that the system
agree.
is set up, it's very much, you come see us, we tell you what you got to do, as if you don't have that ability on your own, right? So it was really just at first just education, support, and now it's evolved to bringing groups of people together. So it's sort of a private practice. It's not a brick and mortar. It's all virtual. I'm here in Oregon, but I can work with people all over the country. I've run cohorts where people are in New York and New Jersey and Minnesota. And so it really allows me to have a much bigger reach. So it's been great. I love
That's
it.
good. So that means that us in Iowa can also
Yeah.
kind of get a hold of you and kind of
Yep.
figure out like, hey, I want to make some lifestyle changes. Like for me, what
Absolutely.
I'm trying to do right now is more preventative, because I
Mm-hmm.
have a horrible family history of just about everything you can think of.
Yeah. Yeah.
And now I'm on the verge of getting up there weight wise and food
Yeah.
wise. And
Uh,
so um, if anyone wanted to get a hold of you, contact you,
yeah.
what ways can they do that?
Probably the easiest if you just go to my website. So it's www.saravit, SARAVIT wellness, all one word.com. And I think there's a consult button, like free consultation. And that's a chance for you and I just to chat 15 minutes, quick Zoom, just to get to know each other. Because the other thing I've realized is it's important to feel connected to the person you're working with, right? It has to be a relationship, and it has to be something that's mutually beneficial, so to speak, right? You have to trust the person you're with.
I
So
agree.
I make it a point to allow people the opportunity to spend 15 minutes with me. And if it's like, wow, you're great, I want to work with you, fantastic. If it's like, I don't know, you're kind of abrasive, or who knows, then that's okay too. But it's that opportunity to sort of say, is this the right fit for you? Answer some questions for you if you have them initially, and then if you decide, yeah, this makes sense, then we talk about what that looks like. Yeah.
Okay, that's
So
nice.
that's the
So
easiest. Just go to my website. Yeah.
okay, that's great, because I kind of took a look at some stuff, but I couldn't quite figure out after I
Yeah.
hit the consult button. I'm like, so what am I supposed to do next? Do I just
Yeah.
schedule something,
Yep.
or
And that's why I like that, because it goes right to my calendar. So I have that synced with my calendar. So all my other things I got going on, it's all in there. So it all, it's connected. So then that way I don't have to worry about managing 15 different things. So yeah, that puts you right on my calendar. Yeah.
Oh wow. You know what? I might look into that.
You got that.
So when they do contact you, they do the consultation and they say, hey, this is for me, this is what I want. What's the next? We just go right into like the nutrition part of it, or
Yeah. Yeah. I mean, usually what I'll do is a deep dive, right, into where you're starting from, because again, there's 6 pillars of lifestyle medicine. So it's where are you with each of those pillars? So usually what will happen is I'll get them onboarded into my EHR. They'll get some information, pretty detailed kind of social history, medical history across all the pillars. I collect all that information. And then it's also about what are your goals, right? This is where you're starting, but where do you want to go? And then we talk about how do you want to get there? We can either do one-on-one, or I'm truly a fan of the group coaching. So there's the group coaching, there's one-on-one, and I've even started to create a habit already up and running. There's a social community that's like $49 or $40 a month, where again, it's just all women. It's just for women 40 and older, where we can all meet there. That's not geared necessarily towards diabetes, but it's really about how do we all support each other towards health. So there's pre-recorded content about lifestyle medicine, and then it's a big social community. It's private, it's protected, where we all can kind of meet. And I'm on there, so you have access to me as well. So there's that really low level all the way to one-on-one, or you want to do group. So there's lots of options. Just depends on what works for you.
Okay. So when it comes to, if I come in and say, hey, I'm diabetic, I'm trying to make some lifestyle changes, how is lifestyle medicine going to benefit me? Or if I'm diabetic, and you know how when you come in, hey, you're diabetic, you need to go on metformin, you got to get on this insulin. I want you to lose weight. I want you to do this. I want you to do that. How will lifestyle medicine help more so that, you know, when you go in to see a physician, a lot of the times, we'll start you out on metformin. We'll come back and see me in 3 months. We'll recheck your A1C. If this is better, if this is worse, then we go back to adding more and more and more to my med list.
Yeah, exactly. I mean, you're spot on. That's exactly how it works. And the way that lifestyle medicine can kind of interject in there, and I like the way you position it, right? You go to your doc, if let's say they've been watching your A1C and they've been telling you, oh, you got to watch what you eat, you know, maybe you need to lose weight. And whether or not you've done it or not, at some point you reach that tipping scale, right? Where they say, ooh, now we got to start metformin. But at any point in that, if you want to investigate lifestyle medicine, and I'll tell you what I recommend. So if you either have type 2 diabetes or your A1C is elevated and you're worried about it, the big thing for most people, I think the misconception is around carbohydrates. So right now, nutrition tells people stay away from carbs, don't eat carbs. And that is a misnomer. It is bad education. I'll change that. It's not bad education. It is outdated education. What we should be teaching is to have people eat complex carbohydrates and to not eat the refined and simple carbohydrates. So that's the first thing that I sort of try to get people to understand, that to get them to reframe their thinking around carbs, because I think we've caused diabetics or those that are teetering on the edge to be frightened of carbohydrates, and they don't want to touch anything that has carbohydrates in it. And that's just, it's not appropriate education. So we should be teaching complex carbohydrates. And then it's about, okay, sugar, right? Don't eat sugar. Sure, don't eat added sugar, but that you can eat fruit. In fact, fruit is good for you. So that's another big shift that I help people try to navigate, because the goal is we want people to eat a high fiber diet or nutritional pattern that's high in fiber. The only way you get fiber is your fruits and your veggies. You're not going to get them from meat. You're not going to get them from things that have been processed. So you want to eat whole food that looks like food. That's what I tell people, right? If it looks like an apple, great, eat it. If it looks like the food, perfectly fine. Complex carbohydrates, and then lots of veggies so that you get lots of fiber. That's super simple, right? Overarching nutritional guidance. But then how do you support people, right? Because nobody's starting from that point, right? Nobody starts, they didn't come to me because they were eating a high fiber diet. So how do you break that down a little bit at a time, manageable changes, and support them with coaching so that it just becomes what they do? And I'll tell you, people that have gone through 3 months of coaching come in with an A1C that's pre-diabetic and they reverse that. Or they come in full-blown type 2 diabetes and we're able to take a point or two off, 1.5 off their A1C after 3 months. And then it's sustaining it, right? It's like, how do you keep that momentum going? So that's the goal, is to support people so they can keep that going. Yeah.
Okay, got a question here.
Yeah.
More questions, keep them coming. Okay. So how do you help a person, it's probably like me too, who can't cook well and need food that is flavorful?
Yeah. So the first thing, and one of the things that I've started to look at, is to bring a nutritionist. I'm going to answer it kind of in a long-winded way. So when I say that, I always take a little bit of feedback, right? So when I started, it was just me, and I kept getting questions about, well, how do I cook healthy, and how do I add flavor? How do I keep this sort of culturally consistent? So I'm West African. I grew up in West Africa. My nutritional pattern now looks very different than what I grew up on, but a lot of the women in my extended family, it's challenging, right? Because West African food is not necessarily food that's going to be keeping them healthy. So there's that challenge, right? How do we still be culturally sensitive, the food that we've grown up with that really carries a lot of emotion for us, but still gives us health? So one thing is I've brought in a nutritionist, have access to a nutritionist that can help to navigate some of that. The other thing is flavor. You can season with herbs and spices. It's the salt that'll get you. So it's also about how do we try to limit the salt without necessarily taking away the seasoning. So that's a shift, right? It's just, and I've worked through this again with some of the sort of the women in my extended family, and trying to sort of give them some guidance if they're ready. That's the other thing. People got to be ready. But you can flavor your food all you want with seasoning and with spices and herbs, fresh herbs, and that kind of thing. It's the salt that gets us in trouble. So you can use I don't know. So what do you like to cook with, Tiffy, if I can ask you, not to put you on the spot, but like from a seasoning, like flavor. Yeah, like flavor.
Use a lot of salt.
Okay.
Seasoned salt.
Okay.
Pepper, lemon pepper.
Okay.
Garlic salt.
Okay. All right.
Sometimes I do like some spicy stuff. So I might do like a jalapeno seasoning.
Yep.
And let's say spaghetti, the Italian seasoning.
Yep.
I'm not a big basil fan.
Okay.
So pretty much like those are my main go-to, to be honest.
Okay. Yeah. So then that becomes that shift, right? How do we still add flavor and start to try to take away some of that salt? And I will tell you that can happen fairly quickly if you commit to it. So within probably 2 weeks, your taste buds will completely change. And what you used to cook with will taste too salty to you. Okay. So it happens quickly. So to a certain extent, it just requires, you know what, my long-term goal and my why. That's the other thing I talk to everybody that comes in. What is motivating you? Like, why now? Why now versus 10 years from now? Like, what is that burn in your belly that says, you know what, Doc, today is the day I am ready? Because if you hold on to that, you're more likely to be willing to make some changes, still with lots of support, but then you've got a good reason to change, as opposed to, well, I'm doing it because my doc said I need to, or, oh, somebody said this is what I should do, right? It's like, no, I'm doing it for me, because I know by making these changes, my 10 years from now looks completely different. And you just do it slowly. So using seasonings, take the salt away in small increments. Don't go from all of that to tomorrow, I'm not using any salt. You'll never stick with it. Just every little bit, right? Take away the salt a little bit at a time, over season things, experiment, be open to just trying new things. And then as far as not cooking well, I think I think there's a misunderstanding that eating healthy has to be hard. I actually find it easier, because I can cut up a bunch of veggies, put them all in a roasting pan. I eat tofu for my sort of protein, or beans are kind of my protein. And I can season that little bit of extra virgin olive oil, season the heck out of it. It all goes in the oven together, and I'm done. I can cook some brown rice, and I put all of that on top of brown rice, or on top of a whole wheat pasta or whatever, and season it as much as I want.
Whole wheat.
So that's actually, for me, what's that?
Whole wheat pasta.
Shift just a little bit at a time. You can do half and half if you want for a little while. Again, It depends on the goal, though, right? It depends on the goal.
Right.
Again, Are you starting out with an A1C of 12, or do you have an A1C of 6.2, or are you not even pre-diabetic, right? It just depends on where you are and what your goal is. Right. So just simple things. So I don't think eating healthy has to be hard. But I've added nutritionists and added health coaching and added these other individuals and expertise because that's what people need to be
Right.
successful. Yeah. Hopefully I answered that question.
Yeah. So what's a good way to incorporate exercise at all levels of ability?
Yeah. Just walk.
Walk.
Just walking. Yeah. I know it's almost too simple. But walking can be great. It really can. Especially if you're starting from no exercise. It's funny. I did sports medicine for a lot of years, and I would get that question a lot. What exercise should I do? And I would ask them, what exercise are you willing to do? Because that's where you should really start. What are you willing to do? Are you willing to walk 30 minutes a day? Start there. Are you willing to get on a stationary bike? Start there. Whatever you're willing to do it at whatever level you are capable of, just to incorporate some sort of motion. But I would tell you, if weight, or even if weight is the goal, and if we have to change a lot, pick one thing first. So let's say we need to tweak your nutrition. Maybe we need to get you to exercise a little bit more. You're only getting 6 hours of sleep, so we need to kind of really work on your sleep, and you're stressed to the nines. So we got at least 4 pillars we need to work on. Start with nutrition first.
Okay.
That is the most powerful lever to pull in lifestyle medicine. So start there. If you try to do all 4 of those at the same time, I find that to be really, really hard for people. So start with nutrition. And if you got to make it even more simple, start with one meal. If it's just dinner that you're going to make as healthy as possible, start there and do that until it's easy. Then do the next meal, and then make it a week at a time, and then make it a month at a time. And then when nutrition is not daunting, then you say, okay, what's the next one I want to work on? Is it exercise? Is it stress? Is it sleep? And you just sort of piece it together. Like, that's my recommendation, and that's what I've seen to be really successful with people.
Okay. That's my issue. I can work out, but my nutrition is horrible.
Yeah.
Bad.
Yeah.
So are you vegetarian or vegan?
I can't say I'm vegan because I still do like cheese. But that's every once in a while when we make a pizza at home. We'll use like a cauliflower crust or a whole wheat crust, tons of veggie, but we use regular cheese. Mm-hmm. So I'm not a vegan because I use regular cheese, but otherwise, yeah, I don't do any meat protein other than that.
So when, I want to know kind of how you feel about, so, everybody's on this whole no carb, low carb thing, but high protein, high fat.
Yeah.
I kind of tried that, and I was like, start with 80 grams of carbs, then go down to 50 and 25. I'm like, I eat a lot of carbs, but I'm like, I can't not carbs.
And that's where I think we've done people a disservice, right? Because I think what we've done is we've made people feel like they need to eat low carb. So I eat carbohydrates, but I eat complex carbohydrates. So I do the quinoas and the whole grains and that kind of thing. That's where my veggies, that's where my carbs come from. So I eat balanced, right? I eat carbs, I eat fat, I eat protein. My protein is plant protein, and the fats that I eat are healthier fats. So the avocados, use a little bit of olive oil, those sorts of things. I use almond butter. I get, some fats in that. But I don't get hung up on my carbs because I know my choices are complex carbohydrates, which again, high fiber. So I know that's leading me in the right direction. Yeah. And I will tell you, for women especially, that low carb thing, it is going to work against you when it comes to weight. It is going to work against you.
I did pretty good one time, but then after I got off of it, started back, right back to where I started. Yeah. So what's a good personal goal to start at or to set for yourself to kind of get yourself into like the mindset of, hey, this is the lifestyle change I want to make?
I would honestly say just take some time to think about, why does it even interest you in the first place? Why does lifestyle medicine intrigue you? And what would be a reason that you would want to explore it a little bit more? Is your health not where you want it to be? Do you have grandkids that, you want to make sure you have the energy and the health to be able to play with them? I mentioned my mom. My mom was young, in her 50s when she died.
Wow.
I'm 51. I've got a 9-year-old and a 5-year-old daughter. I know that I want to be there for them, and that's a lot of
Right.
years. So the choices I make now lets me know and ensures that I'm going to be around for 15, 20, 30 years for my kids. So that's my motivation. That's where CeraVe comes from. It's a blend of my two girls' names. So they
Oh,
are my
nice.
motivation. Yeah. So it's about, why does it even intrigue you? Because it's honestly, it's easier to take a pill, eat whatever you want, take a pill, and we can keep your A1C looking really good sometimes, but that disease process is still going on in your body, right? It's still happening. So you really got to figure out, well, why do you even want to entertain lifestyle medicine? Have a really good, solid reason, and then it'll be much easier to start making some changes.
Okay, so uh,
No,
a question.
I see it.
I
Yeah.
want to lose about 71 pounds. Do you think intermittent fasting is a good approach?
So I don't want to say her, I don't put her out there. I really don't. I think again, for women, I think intermittent fasting is just not the right thing to do for I don't know where you are in your age again, right? So I'm,
Mm.
you know, very peri, if not menopausal at this point. So once you get into your 40s and above, your hormone fluctuation is happening. Intermittent fasting is just, I personally don't subscribe to it. I would much rather people adopt kind of that whole food, plant-based approach, and you'll find that you'll lose weight on that,
Okay.
and it's sustainable, right? That's the nutritional pattern that is not just. I forget. I think it's Michael Greger. He's a doctor that is very much in kind of lifestyle medicine, whole food, plant-based. He said the goal is not to die in a skinny casket,
Mhm. Oh,
right? I
okay.
mean, you can lose weight, but still be unhealthy. So the goal
Yeah.
is to create health. The weight loss is just a byproduct of your choices, as opposed to doing something to drop a bunch of weight, but you're not creating health. You're not optimizing your metabolism. You're not optimizing and lowering your risk of cardiac disease, all of those things. So that whole food, plant strong nutritional pattern, lifestyle medicine
Mhm.
is about health. It's about keeping you around and healthy. You will lose weight. Um, it's just a nice little bonus of it, but
Right.
it's about health. Yeah.
And then there was another question about intermittent fasting being good for a type 2 diabetic.
Yeah.
And
Yeah. And again, it's about, what are you eating? You can do, because intermittent fasting is really about time restricted eating. It says, okay, instead of
right.
eating 12 hours out of the day, I'm only going to eat 6 or whatever. But what are you eating in that time? Are you still eating highly processed foods? Are you still eating sugar sweetened things? Are you still eating the refined carbohydrates? It's, again, that's not going to set you up for a healthy lifestyle. That's not going to reduce your A1C long term. It's not going to change the underlying, changes in your blood vessels that are happening, your risk of kidney disease, your risk of heart disease. That's not going to change any of that just by shortening the window that you eat the same kind of foods. But if you change your food, you can eat whenever you want. You're going to feel full anyway because the fiber fills you up. So you're going to eat less, and you get all the wonderful health benefits of it too.
I really need to do that because I only usually start eating at about 12:30.
Yeah.
Sometimes on the weekend, maybe more like 1, 2 o'clock.
Yeah, that's tough. That's tough. Yeah. And for you, that's hard, right? Because your body, so it's about, how do you put something small earlier in the day? Again, something healthy, get yourself going, get some protein in you, some carbs in you first thing. Again, complex carbohydrates in you in the morning to give your body something, and you sort of, keep yourself sustained so you can get your metabolism going. But that cycle of not eating and then, yeah, I don't recommend it.
Okay. There was another question about lowering your cholesterol without medication because I'm about due for labs myself, and
Yep.
I really don't
It's
want to know
fiber.
what they're gonna tell me.
It's fiber. Fiber is your friend. Yes. Yeah. Again, I've seen it in these group sessions that I run. People drop their cholesterol 20, 30 points in 3 months, better than most statins on the market. So it's about fiber. It's that whole food, eat your complex carbohydrates, if you're willing to do, your beans and your plant-based proteins, your veggies, that's what's going to lower your cholesterol. Absolutely.
Okay. So not necessarily, because some people, some people will be like, okay, I need to take in more fiber. They'll think of, okay, maybe I can try. What are some of the fiber medications you can get over?
Oh, like Metamucil and those sort
Yeah.
of like stir-in type stuff.
Yep. Or like
Yeah.
some people do the smoothies and they'll add like the fiber that you can put in there. Or
Got it. Yeah. Yeah, it's got to come from the food, the whole food, because the fiber is actually, so if you think about like brown rice and white rice, the husk, right? That's where the fiber is. The outer shell is where the fiber is. So you got to eat that. So you got to actually eat that to confer that benefit. Or fruit, usually the outside is where the fiber is. So that's what gives you the benefit. So yeah, much better to eat your fiber than it is to get a mix or a powder that you're blending in something.
Right. Because I've heard also with like with the low carb or no carb diet, when it comes to fruit, they say about the only thing that you can have are berries.
Berries are fantastic for sure. Lots of phytonutrients. They're awesome antioxidants. I eat at least a cup of berries a day, if not more. They're fantastic for you. But I personally would not say that is the only fruit you can eat. You can absolutely eat other fruits, but berries are phenomenal. Yeah.
Okay.
So I saw something about bloating and fiber. Did I see that?
Where did
I miss that one?
Fiber causes so much gas, bloating, but I will increase my fiber. Metamucil I take daily, but makes me sick sometimes.
Yeah. So what I would say is go slow. So again, right? Don't start from, and the standard American diet probably consumes about 10 grams of fiber a day. The goal is you want to get upwards of 40 grams of fiber a day. Please do not do that overnight.
Okay.
You will not like your life. So go slow. Again, pick one meal. Say, okay, you know what? If lunch is the easiest meal to control, because for some people, if you're living in a household and other people are involved and not everybody's on the same boat, that's going to be the most difficult meal to change is dinner, because everyone else is going to be like, what are you doing? I don't want to do this. This is ridiculous. Let's go back to the way. Don't pick that one. If lunch is something that's just you and you can control, start with lunch and say, okay, how can I make my lunch as healthy as possible? And add, a couple extra grams of fiber there. If you can control your breakfast, great. If not, just start with one meal. Do that consistently for a week. And as you increase your fiber, please increase your water. You will also hate your life if you do not increase your water, if you're increasing your fiber. So make sure you're drinking enough water. And then when that lunch becomes easy, then you pick the next easiest meal. If that's breakfast, you start there. And then you go to the most difficult meal because maybe it involves other people and not everybody's ready yet, those sorts of things. But go slow. That will help with the bloating. And then drinking enough water also helps with the bloating.
Okay. Do you recommend any types of supplements to your patients?
So I used to live in Minnesota and even in Oregon here. Vitamin D, right? If you're living in a place where you're not going to get a ton of sunlight, vitamin D is also something that I talk to people about. If you are ready to commit to really eating limited animal protein, if none at all, then B12 is something you need to take, because the only place you get that is from meat. It's actually the animals ingest plants and veggies, and in their digestion they create B12, and then you get it when you eat their meat. So if you don't eat meat at all or animal products at all, then you have to take a B12. So vitamin D and B12 for sure. And then the rest is depending on where your nutrition is, right? Do we need to add anything else after that? Yeah.
Okay. Here's another question. If you want to keep meat in your diet, about how much does your program recommend per meal?
So the way I talk about meat is, the first thing is I educate people on what is the risk with meat. So it's a little off topic on diabetes, but processed meat and even red meat increases your risk of colon cancer.
Oh my God.
Yes. So that's, if I can get people to understand how unhealthy that choice is, if they're at least willing to remove processed meat, so that's your bacons, your sausages, your pepperoni, any meat that's been processed where it really doesn't look like the meat anymore, increases your risk of colon cancer.
Jeez, my son eats a ton of pepperoni.
Yeah. Red meat increases your risk of colon cancer. So if I can get people to at least let go of that, then we say, okay, now we're down to the lean meats, right? The chickens, the turkeys, and the fish. Again, it depends on what is your goal. Are we trying to reverse an A1C of 12?
Mm-hmm.
Or are we sitting at an A1C of 5 and we just don't want to get diabetes? I'd still say, eating once a month, once every couple of weeks is probably the safest. The lean proteins are better. Fish can be a good, healthy alternative. So it's not to say you have to eliminate it altogether, other than, again, red meat and processed meat. I really try to really encourage people to stay away from that.
So my question before we kind of wrap it up is, so I eat out a lot.
Yeah.
Because my son is super picky.
Yeah.
So what are some ways for me to kind of, if I decide to go out, be a little bit healthier and kind of maybe get him to change some of his, because a lot of stuff he eats is not very good. And then from him doing that, then I end up doing a lot of stuff that I shouldn't be eating. So
yeah. So couple things I would say. One, if there's your restaurant that you go to, then look at the menu ahead of time and think about some simple things. Are usually they bring bread to the table.
Oh yeah.
So pass on the bread if you can. Just don't even get it to the table. Tiffy's about to fall out of her chair.
I am. Because we eat first thing when they bring the bread, it's gone before they barely leave the table. And we like, can we get some more bread, please?
So if you can, right? But the thing is, if you can pass on the bread, great. If you can't, can you bring less? Half a basket, right?
Okay.
Because generally, whatever's there, we're going to eat it. I mean, that's just human nature, right? So whatever they bring, you're going to end up eating. So half a basket, maybe skip the basket. So that's the first thing. Okay. Then it's, can you swap out some sides? Because usually there's some sort of side that's, again, potatoes or French fries or whatever, right? So can you swap out your side for something else? Are there some vegetables you can do? Can you load up on something else? Maybe order a side of something else to replace whatever that side is. And where I would start is think of your meat protein in the sort of the portion of a side, and think of your vegetable as the main thing on your plate.
Okay.
So if you can just have that visual in your head when you go to eat and try to create that with your plate. So a smaller portion of the meat protein and then load up on your veggies and fruit.
Okay.
Would be the idea, and pass on the bread if you can, or lessen the amount of bread. And then lots of water.
I drink a lot of water.
Perfect. Keep it up. That's awesome.
Any other questions? Anybody? Well, thank you, Dr. Dunbar.
Absolutely.
We really
My pleasure
having you. Look her up. I've been doing it because I need to make some changes. I'm not quite 40 yet, but I'm almost there.
You got it.
So
I'm happy to do it.
Thank you.
Yes.
And thanks everybody for joining. Look her up. Oh, look, there's another question. What is the monthly fee for your program?
Yeah. So what I would say, let's just start with a conversation. Okay. Just set up that free consult. Let's just talk, because again, it's hard for me to, one thing I've learned, and I think, again, what healthcare does is it just sort of says, okay, you have X. Well, this is how we're going to treat you. Here's why. Not everybody's the same. Everybody has different goals. Everybody's got a different starting point. Everyone's got you have a different endpoint. So let's just have a conversation and let's just figure out what makes the most sense. And then we talk about it. There's lots of options. So it just depends on what your goals are.
Okay. And it's Cerebeat Wellness. Okay. Yes. Look it up. I did.
Thank you.
Make some changes.
Thank you.
All right. Thank you. Thanks everybody. We're out.